next episode of the Hormone Café. I'm Dr. Sarah Pederson. I'm an OB-GYN and I specialize in holistic hormone health and fertility. Today we're going to be talking about something called endometritis, or sometimes you'll hear of it as just metritis. This is very confusing because there's a very similar word called endometriosis, which more people have heard of. But endometriosis is something completely different than endometritis or metritis. It's similar because both of them involve the endometrium, and the endometrium is the inside lining of the uterus. However, endometritis means an inflammation or infection in the inside lining of the uterus. So why is this important? Well, endometritis can cause a lot of chronic pain and lead to infertility. So I want to go over with you what is endometritis, are there any symptoms, how is it diagnosed, and then what's the treatment for endometritis. What is endometritis? It's where you have inflammation or an infection inside the walls of your uterus. Sometimes it can be symptomatic. For example, if you have a lot of pelvic pain, if you have pain on your period, or if you have a certain smell or an odor, or when you're on your period it has a certain odor, that can be symptoms of endometritis. Another symptom is if you have brown bleeding in the middle of your cycle when you're not supposed to be bleeding, or you have brown bleeding leading up to your period, that can definitely be a sign of endometritis or an infection in your uterus. However, some people can have endometritis for many, many years and never know. Things that can cause it are sometimes just having a baby can cause it, sometimes postpartum, because our vaginal microbiome is a lot different postpartum. That can introduce bacteria into our uterus. That can cause it. Miscarriages can cause it. Any procedures in your uterus, for example, having a DNC, having a hysteroscopy, having an IUD, because the IUD strings are in your vagina and your vagina is connected to your cervix, which is connected to the inside lining of your uterus. So all of those things can put you at risk of having endometritis. And some people have no idea that they have it because they have no symptoms at all, or their symptoms are really subtle so that they wouldn't really know. People who have been trying for 3 months or more and haven't been able to conceive, I highly recommend testing for endometritis. Or if you have any pelvic pain, uterus pain, pain on your period, really bad cramps, abnormal odor, or if you're somebody who's had multiple miscarriages and we can't figure out why, or you have a thin lining or something is wrong with your uterus lining on ultrasound, those are all times where I would definitely check for metritis or endometritis. How is it diagnosed? The way that it's diagnosed is that we do something called an endometrial biopsy. And just to warn you, an endometrial biopsy really hurts. Well, what I do is, it's kind of like an advanced pap smear. I take a little tiny straw, a little plastic straw that looks like a little coffee straw, put that through your cervix, and take a little bit of the cells of your uterus. However, even though it looks benign, having that little coffee straw tapping the inside of your uterus, even really gently, can cause your uterus to cramp and just feel crappy for that time. So endometrial biopsies definitely are not fun. But I take those cells that I got, that little sample from the inside of your uterus, and the most important thing is that we want to send those cells for pathology and for culture. Pathology means that the pathologists take the cells, they stain them in a certain way, they look at them under a microscope, and they tell me how healthy they are. Are they strong? Are they well estrogenized? Do they look sad or weak or shaggy? Those are the kind of things you can get from a pathology report. However, you also want to make sure that you send it for specific tests for endometritis. So for example, I have the pathologists do something called CD138 staining, which is specific for endometritis, and look for white blood cells and grow the tissue in a culture so we can literally see if there's any bacteria there. And then they'll get a report back that says you have acute endometritis, chronic endometritis, meaning you've had it for a really long time, this low-grade infection. And sometimes We know how we got it. Maybe we did have a D&C or we had an IUD, and sometimes we have no idea how we got it. It's kind of like having a UTI in your uterus. Sometimes you have a UTI or a bladder infection and it's obvious, like, oh, I left a tampon in too long, oh, I was in a hot tub. But sometimes we just get a UTI out of the blue and we have no idea how we got it. Sometimes endometritis can be like that because our vaginas are open to the world, and because our vagina is connected to our cervix, connected to our uterus is technically open to all the bugs that we're exposed to in our daily environment. So we don't always know how we get metritis, which is why I'm very, very anal about checking for it, because it's very easy to treat. So what is the treatment for endometritis? The most common thing that we'll do is give antibiotics. Of course, we want to try to avoid antibiotics as much as we possibly can. However, metritis is just one of those infections that's really, really hard to cure with natural and holistic remedies and natural antimicrobials. Even oral prescription antibiotics do not have great penetration to the uterus, so we have to give a long course of antibiotics even to touch the uterus. So that's an area where natural methods don't really work, and that we really do need to use oral antibiotics. So when we do oral antibiotics, we definitely make sure we're having a probiotic so that we're not killing off our healthy gut microbiome. And then once I do a course of antibiotics, I always retreat and do a biopsy to make sure that it's gone, because you don't want to take antibiotics and then still have an infection in your uterus and you don't even know it. So I retest until we know that it's 100% gone. Sometimes that requires multiple rounds of antibiotics. However, we don't want to give you too many rounds of antibiotics because that can cause resistance, and that can really throw off your gut. So if you have chronic metritis, it's not working to treat it with oral antibiotics, there's other options. The other options that I can do are do an antibiotic wash inside of your uterus. So instead of taking oral antibiotics, we can do liquid antibiotics and literally put them inside your uterus and let that antibiotic wash heal the infection on the inside. Another thing that I can do is a steroid wash, where I take steroids and inject them inside of your uterus and do a wash or a flush, because steroids can have healing properties where it fights that bad bacteria and it can help your body treat that infection on a local level. The other thing that I do for chronic metritis is something called a PRP, intrauterine wash. It stands for platelet-rich plasma intrauterine wash. PRP is where we take your blood out of your body. We usually take about maybe a quarter of a pint of blood, and then we isolate just the plasma, so the liquid part of your blood, and the platelets, which are the healing cells. So we take the healing cells from your own body and put them inside your uterus so they can really help heal that area that's damaged from having an infection. So there's other options that we can do if you have chronic metritis and it's not responding to regular antibiotics. Those are lots of different options. Some people just have that flush or that wash, whether it's with steroids, antibiotics, or PRP one time. Some people have it multiple times. But again, I always re-biopsy to make sure that the endometritis is completely gone. And then of course, on the back end, we need to be doing things in our life to make sure that we're not feeding or flaring up the infection. Make sure that we're not eating a lot of sugar, because sugar grows bacteria, and that we're eating enough protein, omega-3s, vegetables, high quality grains to support our natural estrogen production, because estrogen grows new blood vessels and estrogen grows our uterus lining. So we want to make sure that our estrogen is high enough that we're growing a nice healthy uterus lining, and that there's a lot of good blood flow to our uterus so that our body can fight off that infection inside of our uterus. So anything that's causing your estrogen to be low can inhibit your body from being able to fight that infection. And then on the other side, we want to support our immune system. So whether that's we need to support that with our diet, whether we need to take supplements to support our immune system, whether we need to do something like take colostrum, it's really important that our immune system is robust, because having a chronic infection in your uterus is really hard on your immune system. That can cause you to be exhausted all the time because your immune system is working overtime. So if you are a person who is worried that you might have metritis, or you've never checked for it, or you feel like you've checked all these things and you're still not sure why you're not getting pregnant, or you have a lot of pain or pelvic pain, soreness in your pelvis, soreness in your vaginal area, pain when you're on your period, it's definitely worth it to get checked out for something called endometritis or metritis. In other words, an infection inside of your uterus. Today we discussed what is endometritis, what are the symptoms, how is it diagnosed, and what are the different treatment options. So if you're hearing this and you're thinking, maybe I have metritis, please come visit me. We can do a biopsy. We can make sure we're optimizing your whole lifestyle and all your supplements, everything that you're doing to make sure your body is as healthy as possible. Check and see if you have an infection. You can schedule an appointment with me, Vera Fertility, or check us out at verafertility.com. Thank you for joining us today on the Hormone Café. In the next episode, we're going to be talking about vaginal health and vaginal infections, so stay tuned.